Tissue changes secondary to glaucoma. Retinal changes. Glaucomatous retinal atrophy. Nerve fiber layer hemorrhages. Ischemic atrophy of the following structures: nerve fiber layer, ganglion cell layer, and inner part of inner nuclear layer. Hyalinized appearance and gliosis of inner retina. Optic nerve changes. Early, loss of axons, blood vessels, and glial cells. Tissue loss starts at lamina cribrosa, especially superior and inferior poles of the optic disc. Generalized cup enlargement. Large optic cup, asymmetrical cup more than 0.2. Focal cup enlargement, localized notching, vertical elongation of the cup, splinter hemorrhage, nerve fiber layer loss, vessels overpass, vessels are hanging with no underlying neural tissue, peripapillary atrophy. Glaucomatous optic atrophy, tissue loss extends behind the lamina cribrosa, cupping of optic nerve, deep cup, overhanging edges. Loss of nerve tissue anterior to lamina cribrosa. Posterior bowing of lamina cribrosa. Widened subarachnoid space. Widened pile septa. Gliosis and decreased diameter of the nerve. Schnabel's cavernous optic atrophy. Glaucomatous optic atrophy with large cavernous spaces within the nerve parenchyma filled with hyaluronic acid. Hyaluronic acid permeates from the vitreous into the cavernous spaces. Follows repeated acute attacks of increased intraocular pressure and anterior ischemic optic neuropathy. Scleral changes, staphylomas, ectasia of outer coat of the globe lined by uveal tissue. Corneal changes, corneal edema, epithelial edema, intra and intercellular epithelial edema, stromal edema, hydropes, congenital glaucoma, due to sudden breaks in Descemet's membrane, Ihab stria. Bullous keratopathy, band keratopathy, degenerative pannus, corneal vascularization, and corneal scarring. Eyeball changes. Eyeball enlargement in congenital or infantile glaucoma, with thinning and stretching of cornea and sclera, leading to lens subluxation due to mechanical rupture of stretched zonules, cataract formation, and atrophia bulbi. Focal ectasia or staphyloma in adult eyeballs. Iris changes. Necrosis of iris muscle fibers in acute congestive glaucoma. Segmental iris atrophy, pigment dispersion, fibrosis with ectropion iridis. Ciliary body changes. Atrophic ciliary processes with hyalinization.